What is the subtle role of inflammation in osteoarthritis without swelling? Imagine feeling a dull ache in your joints that comes and goes, but you see no redness or swelling. That's often how inflammation works in osteoarthritis. It can be sneaky and quiet, yet still very important. Osteoarthritis is mainly known as a wear and tear condition, where cartilage in the joints gradually breaks down. But beneath that surface, a low-level inflammation quietly stirs within the joint tissues. This inflammation is not like the fiery redness or swelling you see in other joint diseases. Instead, it is mild and localized, mainly inside the joint. It happens in the lining of the joint called the synovium, in the cartilage itself, and in the bone just beneath the cartilage. When cartilage starts to wear down, it triggers a small immune response. Immune cells like macrophages become active and releases molecules called cytokines. These cytokines are like tiny messengers that tell the body to react. Even though this process is gentle, it can cause pain and further damage to the cartilage. Because the inflammation is mild and intermittent, it often doesn't cause the classic signs of inflammation like redness or swelling. Instead, it affects the nerve endings inside the joint, making you feel pain or stiffness. This is why some people with osteoarthritis experience discomfort without any visible signs of swelling. Sometimes, the inflammation flares up temporarily, leading to periods of increased pain. These are called flares and happen when the inflammatory activity temporarily ramps up. It is important to understand that this subtle inflammation is different from the intense, widespread inflammation seen in diseases like rheumatoid arthritis. In osteoarthritis, the inflammation is more localized and less aggressive, but it still plays a big role in how the disease progresses. Recognizing this helps in managing osteoarthritis better. Treatments like exercise, weight control, and certain medications aim to reduce this low-grade inflammation. Doing so can slow down cartilage loss and reduce pain. Knowing that inflammation can be present even without swelling helps doctors catch osteoarthritis early and start treatment sooner. This way, they can help slow the disease and improve your quality of life. So, in osteoarthritis, inflammation acts quietly inside the joint, contributing to pain and tissue damage without showing the usual signs of swelling. It's a subtle but powerful part of how the disease develops and affects you.